Hello, my name is Greg Shaw. This is speech 1101. Adam Polson is the instructor, and this is November Persuasive Speech. Okay, as I said, my name is Greg, and this is a persuasive speech. If this country is serious about ending the AIDS epidemic, we must recognize the human and economic benefits of syringe service programs. According to different studies, needle and syringe service programs, or needle exchange programs, which is a little easier to say, not only reduces the spread of HIV and other bloodborne diseases, but it also saves money. It encourages the safe disposal of disposing of the syringes, minimizes the risk of needle stick injuries to law enforcement personnel, and also it helps give people who inject drugs access to vital treatment services. I will introduce to you a solid baseline of facts and documentation to show that needle and syringe services are a much needed service in our communities. First of all, a little history. What is the AIDS epidemic? In 1983, the virus that caused AIDS was discovered by a scientist in France and with the routes of transmission. In other words, the way a person caught it was confirmed. The virus eventually became known as the human immunodeficiency virus, HIV for short. HIV infection affects one's immune system. The immune system is our body's defense against infectious bacteria or viruses that get past the skin or the mucous membranes. Our immune systems produce special cells called antibiotics to fight these germs or antibodies. HIV infects and eventually over time destroys these fighting cells in our immune system, which slowly leads to a persistent, progressive, and profound impairment, making the individual susceptible to infections and conditions such as cancer, pneumonia, influenza. When the immune system becomes very affected, the illness progresses from HIV to AIDS. You're probably thinking, what does a disease for homosexual people have to do with needle and syringe services? We've stereotyped this disease to homosexual people, when in reality it's a humankind illness. It is spread through unprotected sexual intercourse or through contact with infected blood or body fluids. In the past, not so much lately, but it was also passed when we transfused blood products. For the purpose of the remainder of this speech, HIV is also wild and rampant amongst needle syringe drug users. I propose the government funds either office spaces or a vacant store, parking lot, a portable vehicle, some safe place where drug-dependent individuals may come and receive new needles. There'd be clean needles, there'd be non-shared needles, a clean environment, a safe place to be able to inject the drug of their choice without fear of being arrested, and when finished, to receive clean needles when done. Well, that certainly opens a can of worms, doesn't it? Ethical issues arise. Many comments, such regarding the needle exchange program. One person said, "How dare we promote addicts continuing to pump these drugs through their veins?" Another said, "Do they know how many children suffer from one or both parents spending hundreds of dollars on drugs instead of the household bills? Just what we need." Another one says, "Oh, let's support the druggies." What, we don't want them sick? We don't want them to die? Why not? Yet another, aren't they stealing from us hardworking taxpayers? Give them dirty needles. Do the world a favor. First of all, let's get things straight. I'm not saying let's legalize drug use. We need to understand these people are going to use no matter what. It will give a prophylactic approach to help prevent the spread of HIV. Needle exchange programs have been operating for about 2 decades now in some major cities. What's more surprising is the research demonstrating the effectiveness of these programs in preventing the spread of this infection, guiding those sufferings with addiction to safety, and saving taxpayers money without increasing crime rates. According to a study done in 2011 by the Canadian AIDS Society, each new diagnosis of HIV, whether it be from a junkie sharing a needle, whether it be from a police officer getting a needle stick while searching someone or reaching in the back seat of his car, or, heaven forbid, a child who picks up a needle in a park and pokes himself or herself, which is common. This needle is a picture of one that was found near a playground. Living with HIV has an impact on an individual's quality of life. The dollar value that impacts the quality of life has been estimated at $380,000 per person. Now you add the health cost to that, which is $250,000. Now you add the labor productivity to that is $670. So in grand total, each new HIV costs approximately $1.3 million per person. Now doesn't that change it a bit perspective? Isn't it time we do something? Most junkies do not have the privilege of these needles to prevent needle stick and prevent using them again. They use these ones. It'd be like this. This would be the kind that they're using now. They pull it off, they just reuse, they shoot, and they recap it. Some places are saying they should rinse it with Javex. Most people don't have Javex. So with these needle syringe programs, they would come into the building and they would get needles like this. And to prevent it from being further used, in order to totally inject what they want to do, as soon as they push it to the end, that needle is gone. There's no way of getting that needle back out. So even if they threw it in the playground, nobody can get jabbed. Needle exchanges place harm reduction over all else. Harm reduction holds the health and well-being of the individual as the primary concern. Attempts should be made to reduce the harm of their habits as much as possible. This approach to addiction, I believe, is compassionate. Needle exchange programs don't condone drugs. They offer care. Providing clean syringes and needles to intravenous drug users does not say that we condone their behavior. It says that we care about them and their partners to be healthy as a first step to being a productive member of society. Needle exchange programs protect the public, not just the drug addicts. While some may argue that drug users must live with their consequences of their decisions to use dirty needles, the issue is not about helping drug addicts avoid disease. It's also about protecting the public from the consequences of the spread of these diseases, such as that picture. The consequences include increased risk of infection, as well as increased taxpayers' cost in providing health care for more sick people, $1.3 million per person. Needle exchange programs help protect the families of drug addicts from the possibility of their loved ones acquiring a potentially fatal disease such as HIV. I challenge you to think of these exchange programs as a new social service, employed with counselors, people who care, proper nutrition, a nursing team to monitor the injections, ears to listen, rehab services. Remember, our goal is to respect people as people, not treat them like drug addicts. Needle exchange programs are supported by some major medical public health organizations such as American Medical Association, the American Pediatric Association, the Red Cross, the World Health Organization, Health Canada. In closing, again, I state, if this country is serious about ending the AIDS epidemic, we must acknowledge the benefits of these much-needed syringe service programs. Thank you.